the dental work for this one enclave, and the children responded tremendously. You look at the kibbutz in Israel, and that is a self-contained community where the only people that have major interaction with the children are high-quality child care providers that understand how to develop a healthy, functioning child. These individuals from this community in the kibbutz are usually the leaders of the community, the Jewish community, because of the early intervention and prevention that they received in that gated or in that community that was designed for success. The community that I just mentioned is designed for failure. We must not think of reform, we must think of revolution. And these are some of the things that I have saw and have worked with to be successful, a successful solution, partial solution to the problem that we face in the inner city.
Oftentimes people talk about reform, whether it's political, economic, or whatever, but I have a somewhat of a scientific background, and I know if I bought some clay and it didn't meet the quality standards of the manufacturer, it wouldn't matter how I tried to reform the clay, the end result is going to be the same. When I put it in the kiln, let's say, for example, this clay was deficient in some minerals or whatever, so no matter how you tried to put it in the kiln and fire it, the end result was always a cracked piece of pottery. So I like you using a term like transformation, and what was the other term?
Revolution.
And revolution. You know, something that would totally change
the system. We must use small groups. Our children learn better in the African tradition of small groups, active learning, spiritual learning. Okay. And this is what they respond to. They do not respond to the European, you sit down, I dictate Socratic type of teaching where you listen to me and I teach you. They do not respond that way. Children that have had these deficiencies respond to small groups, personal interaction, and an active style of learning. Marie Montessori. Marie Montessori said you must learn to follow the child, and they will teach you how they learn. We do the opposite. We try to teach them the way that we want them to learn. Right. And we're losing them to the environment that they have to try to overcome.
Well, that's well, I'm glad to hear some of these having healthy role models and these behavioral specialists to help bring it. That's like more or less like ancillary services, supplemental services to help balance the child out, to give them an opportunity, so to give them the readiness so that they can learn.
We're talking behavior modification. Now, you cannot modify behavior if you have not been trained on how to do that. So that's where the behavioral specialists come in, that they are highly trained and qualified to change that negative apperception or how a child sees themselves, others, and the world. That is a negative thinking pattern that encompasses many children in the inner cities. By the time they're 3 years old, they are trapped with this negative thinking pattern and doomed to a life in the inner city if intervention is not forthcoming.
And what I would like for you to do, because Dr. Johnson always takes the position, and people oftentimes call us and they want to get additional information. If you know of any programs in the Chicagoland area, around the country, that provide similar high-quality services, similar to what Dr. Johnson is talking about, please let us know, because we get phone calls and emails, and people may want that information. And of course, if you need more information on what Dr. Johnson is talking about, the SOS Children's Village, now that's on 76 and Parnell.
Absolutely, yeah.
On the south side of Chicago.
Right.
and their model for service and foster children is somewhat different. And Dr. Johnson put me in touch with a young man, Joe Mason, which has an organization to help people such as myself, because single parents are fathers too, and they need much needed guidance and support in helping in the development and upbringing of their children. So you brought us a lot of resources here talking success, and that's why I was reaching out, because I know you're open-minded, that we may hear about some agencies that may be interested in some of the concepts that not using the wraparound services. You know, you just can't assume that agencies are dealing with foster care, are dealing with children that's wards of the state, or just when a single mother or a single father brings their child to an agency for, let's say, some psychological services or some social work services, that they may not be providing that. Because I think when you first came on, you told us that youth and family guidance is oftentimes called into agencies that don't have the professional staff members that you have, that can come into their agency. They don't have to hire them. They just call you and say, Dr. Johnson, we need a couple psychologists to do some testing. We need a couple psychologists to do some assessments. We need a couple psychologists to do some one-on-ones or whatever. So you help those agencies out with the people that work with you on your team to give those children and adults the wraparound services they need.
Absolutely. That's what we do. We provide the clinical and therapeutic services for organizations that are in need of these services with children, families, and adults. SOS is one of our contracts that we provide these services for. And when they had their grand opening, they opened a beautiful edifice there on 76th and Parnell, and Mayor Daley was there. And one thing he said is that we need more programs like SOS that works not only serving foster children, but for the entire community. So what he was in essence saying is that we need these type of village approaches that they do in the kibbutz in Israel, that the young man did in New York, here in Chicago. So he basically agreed with everything that I am saying tonight, that that's a tremendous need.
Well, that's great, because like I said early in the program, I don't know if you just tuned in, we hear so much about the problem, the problem, the problem, the problem. And sometimes people understand there is a problem, and you had explained early in the program what causes the problem. I wanted you to reiterate on that for anybody that may have just surfed in late, that it's the underdevelopment of the children by the time, you said, what, age 3?
Age 3. In normal development, we know that personality is the way that you see yourself, others, and the world. Some people see themselves as very capable, see others as caring, and see the world as a place that they can meet the challenges in. In the harsh communities of the inner city, by 3 years old, the person sees themselves as negative, sees others as uncaring in most cases, and sees the world as a very hostile place. So when you approach life in that direction, again, the theory of attraction says that that's what you're going to attract to you. And so we must try to help them turn that perception of themselves, others, in the world to a more positive way of looking at themselves, others, and life.